If you're getting ready to come into Medicare, I've got some great news. Medicare is actually pretty terrific. You're likely going to find Medicare to be a much better health insurance option than what you've had previously before coming into Medicare. The costs are reasonably low and the out-of-pocket can be very low as well. So that's not to say it can be confusing trying to figure it out coming in. So that's where we're going to try and make things easy for you. I'm Keith Armbrecht, founder of Medicare on Video, and I help people across the country make the right Medicare choices. And I can absolutely help you as well. The best part, there's no cost to allow me to help you. So hopefully you'll take advantage of all the information that I have, and then I'd be glad to help to make sure that we get all your pieces in the right places. Right now, I'm going to talk a little bit about Medicare and how things function when you first come in. And there's always questions later, so if you have any questions on Medicare, feel free to send me an email, give me a call. I'm happy to do whatever I can to make sure you get the answers you need for Medicare. So we have free Medicare visits. So you hear about this sometimes, and exactly what it is, you need to really understand. There's two categories of this when you are coming into Medicare, and then also when you are in Medicare. The annual wellness visit, and it can cover things like health screenings, vision tests, your history, things of that nature. So how it works is when you first come into Medicare, there's an initial wellness visit, and you need to do this within 12 months of when you start Part B. So you can call your doctor's office and tell them you want to have your initial wellness visit coming into Medicare, that you're new to Medicare. So that will be covered 100%. And then after your first year, you can have an annual wellness visit. Now, there's a couple of things to understand about how these functions, because there's confusion on exactly what they are. So the cost is zero. There's no cost to you as long as your provider takes Medicare assignment, which the vast majority do. So you just want to make sure that you kind of cover that up front, that there is no cost. The Part B deductible does not apply. Now, what do we need to understand is what you're going to bring, and this is really if you're going to a new doctor. If you're going to your regular doctor, you're probably going to have your medical records, your family health history, and a list of your current medications. So you want to have that if you're going to a new provider. And then what's important to understand, it's not a physical. So this is an annual wellness visit. They're going to give advice on certain things, but it is not as comprehensive as a physical. Your doctor can work through that with you on if it's recommended on whether or not you have a physical. So those are your free Medicare consultations when you come into Medicare, and then also when you have been in Medicare after your first 12 months. So certainly take advantage of it, because it's a good idea to go talk with the doctor, review your history, review your medications, make sure you're doing the things that you're supposed to do, and then it just keeps getting easier from there. So I hope you found this helpful. And if there's anything I can do, feel free to give me a call, send me an email. Again, I'll help with any of the questions related to Medicare. You can visit MedicareOnVideo.com. You can get an immediate quote for a Medicare supplement plan in your zip code. And that's what we do, is we help people figure out the right supplement to go with their A and B. And again, no cost to you to allow us to help you, so I'm happy to do that. So I hope you found this helpful. Have a fantastic day.